The following is a conversation with Dr. Zach Sapolsky, a clinical psychologist practicing in New York City. My introduction to Dr. Sapolsky dates back to my undergrad years at Baruch College, where I took a course he taught on personality psychology. Today, we delve into the profound impact of digitalization on human connections, navigating the challenges of a hyper-connected world and the transformative power of education. I'm your host, Tesher Zafran, and this is Dr. Sapolsky. I think it works. Thank you so much for taking the time.
Of course. Thanks for having me.
I want to dive right in. I know our time is limited, but I thought we might actually start by time. I want to ask you, how do you balance all your commitments? You're talking to clients, you're supervising, clinical students, you're talking to me for, how have you, how do you manage all of it?
Very carefully, I guess. I think it's difficult. Although, as a clinical psychologist, I feel like that's kind of the career I envisioned and signed up for. One of the things that I liked about becoming a clinical psychologist is that I didn't just do one thing all day, every day, or sit in an office and do the same thing. And so balancing teaching, balancing supervising, seeing my own patients, all the stuff that I try to do, I try to build in a variety every day. So I'm interested in something new that's coming up. And, whether that's a new patient or an exciting moment or with a particular patient or some, a supervision or a didactic that I'm leading, whatever it is, I want to be continuously engaged as best as I can. And so I think that's why I try the variety for me.
For those that are unfamiliar, can you distinguish clinical psychology from other branches of psych?
Yeah, I think clinical psychology can encompass both sort of the scientist research side and also the practitioner side, but it probably is most associated with understanding assessment, diagnosis, treatment of, both severe and everyday psychopathology. So it's probably the most general of all the tracks that one could become a Ph.D. in. I mean, if you're a developmental psychologist, you may be more researching in that area, or an educational psychologist or this or that, but clinical is probably one of the more, broad types, so that it sets you up to do a lot of different things. And so I have friends who are clinical psychologists who work in schools, who work with kids, who work in research, who work even in business. So I think clinically you really do think of treating illness.
What do you think drew you to the field? And then perhaps what's most rewarding for you now?
Those are two interesting questions. I think what drew me to the field? I mean, psychology was sort of something that really was, and psychotherapy in particular was something that was in my family. And so I, around the dinner table when I was 9, there were discussions of, of that nature. So I kind of grew up with the idea. In fact, in my family, it was, so I know so many families, psychotherapy is thought of as quite different and maybe even a little bit strange or bizarre. But in mine, it was sort of like, if you're not in therapy, like, oh, you're not curious about yourself? Like, what's that about, right? So it's a little bit the opposite. So I think it was always in my bones, so to speak. And I first wanted to be a lawyer. I think that's when I went to college to try to think about. And then pretty much after my first psych class freshman year, I was like, no, going back the psych
Yeah.
route. And what was your other? Oh, what I find the most rewarding? What I find the most rewarding. It's hard to really pick a favorite. I find, you know, so many different things rewarding. Working with couples, working with families, working with patients who find something unique out about themselves or surprise themselves in new ways or discover a part of themselves or a relationship that feels like it's new and exciting and satisfying. And that's really satisfying for me. And then also to see supervisees or students grow
Mm-hmm.
and find that they can help people too. I think that that's, discover their own voice in that.
I, the image of the dinner table and having these sort of more introspective conversations. Were either of your parents psychologists?
My mom was a
Okay,
psychotherapist. So she was a
understood.
clinical social worker who has been in practice for, oh boy, probably over 50 years. So,
Gotcha. And so, yeah, so there was that natural curiosity there. Um, what I'm curious. I guess two things. One, do you think that um, do you think every this is a question I've always had sort of do you think everyone would benefit from therapy? And then as a corollary, what are some of the most common reasons that people come to you for therapy? Are there any pattern, what are the most common illnesses that you treat?
I think the answer to the first question is uh, there isn't one type of therapy for everyone, but I think
Mm,
that everyone can benefit from some kind of psychotherapy. I mean, I call to mind when I worked at the Bronx VA hospital. I would say that the men's group that we ran with 25 veterans, I would say most people would say, well, these are people who would be the least likely to sign up for individual therapy. Uh, were defended against feelings, were traumatized in so many ways, and very much would probably be stereotyped as people who would not want to get vulnerable, but they did.
mm,
And they found this
mm.
very powerful group of men to relate to. And us psychologists took a back seat and we just let everyone really
Yeah.
support each other. And it was something that was really magical. They became incredible forces for constructive um, dialogue and helping each other through really trying situations and leaned on each other in a lot of moments of sorrow and stress. And so was that a traditional type of individual therapy? No, but it was therapy that helped them, group therapy.
Mm.
So I think that yes, one can find something anywhere.
How would you define the limits of what therapy is in that case? Is it a conversation that leads to, or I suppose talk therapy? Because it seems to me that the more loosely you define it, the more broadly you can say that it would help anyone.
Right. I think that, I don't think anyone needs to gatekeep about what is therapeutic or what's not. I mean, there have
Mm,
been behavioral therapies that have been very helpful for certain people at certain times. There have probably been behavioral therapies that have been very unhelpful. And I think there's
mm,
probably insight oriented talk therapy that focuses on emotions that might be right for one person, and more cognitive work would be right for somebody else. And so, I don't know. I think as long as participants are engaged in some sort of meaningful interaction in which uh, they develop some sort of connection to
mm,
themselves, to acknowledgement of their own psyches and realities, and can
mm,
develop some sort of constructive, fruitful balance of some sort in their life. I think that's what it is. And I have a long time friend colleague who says, well, therapy is a conversation. between two people, and some maybe one talks more than the other, but it's a relationship, and you grow in through that.
How do you go about that initial assessment? I'm always curious that first sit down. What are you looking for? How structured is it?
It's a good question. I think for me, I have really been trained in a lot of different ways and
Mm,
modalities. So everything from administering a SKID, a symptom questionnaire at a hospital, to a very formal, structured interview, all the way to something incredibly informal where
mm,
you're just doing play therapy and you're,
mm,
watching and observing and interacting with a child who's engaging with play materials and
mm,
trying to understand that. So I think it depends. I probably with most adults, and I do see it adolescents, I see adults, but with most adults who come in, I'm trying to strike an initial rapport with them, connect with them on their terms, see where they're coming from, understand what it is to be them, and
mm,
I'm trying to understand essentially what it's like to be in the room with them and what their struggles are, what gets in their way, what you know, their how they relate to
mm.
themselves, to in relationships, and some of the way in which they defend against um, certain things that might be painful. And so, I'm interested in understanding that feeling in the room with them, and both on a content level and then also the process that goes on between us is unique with every single person. And to try to pay attention, to listen, to be present and attentive and um, curious and interested in everything this person brings to the table. That's what I'm about. And hopefully we form a lasting, meaningful connection that they'll find, very helpful as they go through life.
So it sounds like that initial visit is just it's rapport building, it's listening, it's yeah.
It
You said you were
is.
trained in a few modalities, and I appreciate you said it's in a large part it's about fitting it to the patient. If it's with a child, maybe it's just observational play therapy. Is there one in particular? So with the caveat of I understand that it's about uh, fit. Is there one that you're particularly comfortable using that you've found to be particularly effective, or is it just really a mixed bag?
I think I've been trained analytically, so I think
Mm,
or psychodynamically, however you want to think about it, to conceptualize the person holistically, to look at the person in
mm,
totality and understand all the pieces of what it means to be them. And so I do, within gets a little wonky, but within the under the umbrella of psychoanalytic theory and thought and treatment schools, there's a lot of different theorists, and so I think there's something to be sort of borrowed from each of them in helps, in the conceptualization of a case. Sometimes come from a more, like for example, object relations or relational point of views. They're different, but self-psychological, more classical. I was trained at the Karen Horney Clinic, who were at the American Institute for Psychoanalysis, which was started by Karen Horney. And so I incorporate a fair number of her ideas in my mind in terms of conceptualizing. But that's really kind of the beautiful matrix of what psychotherapy is how you conceptualize a case is interesting, and it has
mm,
some relationship with how you treat the case. It should. They have some, kind of connection there. But often, that whole, all those theories, all those conceptualizations hopefully seep into your bloodstream and become sort of integrated so that you
mm,
can have a natural, authentic interaction with this person. And so, what it looks like to be in the room with someone and have that kind of relationship, well, maybe I will kind of work with somebody from a self-psychological lens, but I might
Mm,
incorporate some cognitive types of
mm,
ideas, from the cognitive behavioral theoretical perspective, if that's what seems to work with this particular person. And hopefully it's collaborative, right? Everything is sort of co-constructed with this person. So
mm.
um somebody's asking me, hey, well, how do I kind of like understand this particular belief system, or how do I get you know understand this particular rut that I'm in. And maybe I'll take advantage and integrate different theories and different kinds of treatments, strategies, and interventions to help them with that. So I think that's I think it's something that requires a lot of thought and careful consideration outside the consulting room, like outside the therapy room, of like,
Mm.
ooh, let's really think about this case. But hopefully you've done enough thinking and integrating so that when you're actually in the room with the person, it comes naturally and you're just you,
Mm.
and you're just
Yeah.
able to help that person in the moment the best way that you know how.
Yeah. You can't be in your head trying to apply granular details of some kind of
No,
theorist when you're having a conversation with someone.
that's right.
No, it has to be absorbed. You said
That's
in the
right.
bones. So you said the this distinction I'm always fascinated by between uh, a therapist inside the office and outside. I'm curious in your training, um, how you were it's a burnout is famously prevalent among this profession. So I'm curious what strategies you've learned to not take you know things home with you. How do you stay sane? Are there any technical things that help? And then have you just learned something along the way that is perhaps generally applicable to people who aren't having hard conversations for a living?
Hmm. Well, not all the conversations have to be hard. They can be
Fair
they
enough.
can be
Fair enough.
fun too.
Yeah.
But yeah, I think that's a great point, and it probably connects back to maybe your first question, which was, or one of your first questions, which was about how the variety of my week takes shape. So I
Mm,
do think I would probably suffer from burnout if I was doing the same exact thing every day, all day, and only using one portion of my mind. But I think the fact
mm,
that I am lucky enough to dip into different parts of my personality, dip into different parts of my curiosity, in terms of teaching or educating someone through a didactic at a group practice or that I work at, or maybe it's consulting on something with somebody, or doing some writing, publishing a paper, whatever it is, and then working with a patient. All that kind of keeps it fresh and new,
mm,
and keeps different parts of my curiosity and mind alive. And how do I not bring it home with me? I would say that I do bring
mm,
my analytic side of me to it. I guess the way I described it is that in some ways, and I think hopefully most sort of therapists and clinicians can relate to this, that we always have the ability to turn that part of our minds on, to so to speak, right? That, like, to be like, what was that there? I wonder why that person said that, or why was I feeling that way? Hopefully that's accessible for all of us, and hopefully we help other people who are not in the field to access those kinds of, that kind of psychological mindedness part of ourselves. But so I think that's always there and possible. But when you're with your family, when you're with your loved ones, hopefully you're just kind of in the moment, and just like you
mm.
would be in a therapy session, but have that ability to draw on a little bit of an observing ego to wonder and be present in a variety of ways. and be interested in what's going on. So I think that part of me says, yes, like I do leave a great portion of my work at work, but the psychological sort of interested part of me is always available.
Mm. Yeah, and then variety and balance.
Yeah.
Just yeah, interesting. Um, Here's a question. So I'm reading a book right now called the oh shoot, Psychomanic Edge. And it's sort of a pop psychology book. The point being, I'm a sucker for these like pop psychology books. I'm curious from your perspective, are they a good thing? Are there any good pop psychology books? And if so, are there any that you can recommend?
That is a good question. Pop psychology books. You know, it's funny. The first thing that came to mind was, Karen Horney's books, which were, it's kind
Mm.
of funny. I don't know if they would have called it pop psychology, but she wrote these very um, interesting and accessible books for the masses in the
Yeah,
early
they were
part of the.
popular.
They were really
Yeah.
popular. I mean, it wasn't this wonky journal article that takes you 2 hours to read a
Mm.
page. I mean, they were very kind of, so I mean, I think Our Inner Conflicts was fantastic. I don't know if that's a pop
Could you
psychology book.
briefly speak to who Karen Horney was for those
Sure.
who aren't familiar?
She's someone who was almost never talked about in any of my
Yeah.
graduate career. And she was someone who sort of founded her own brand of or land of psychoanalysis, and so she's kind of labeled maybe an early feminist psychoanalytic thinker. She was interested in how culture impacted the person in their time, and how certain kinds of neuroses and symptoms were shaped by one's culture, one's society. So she gave that. She sort of tried to integrate the intrapsychic and what was in the sort of external milieu. And I think one of the major takeaways that I always got from her was these ideas that the idea is that every person has sort of their own mountain to climb. Every person sort of deserves to understand themselves in totality, and a lot of us sort of, because of how we were brought up, or the families or the systems that we kind of come from, constrict a lot of our personalities, our character,
Mm.
because we either don't feel like those pieces of us would be accepted or loved. We feel a certain amount of anxiety or distress or hostility when those are present. And so we kind of streamline those pieces of our personality, and so we lose parts of ourselves to some extent. And so her brand of therapy was just trying to help somebody expand what was possible. It was not about depth, it was
Mm.
about breadth, about understanding oneself in
Mm.
relationships with others, interpersonal relationships, and the relationship with yourself. And so, kind of working on some of the defensive ways that people try to protect themselves, and working at around issues like shame and inadequacy, and helping someone really accept more of themselves, so they can feel a
Mm.
little bit more connected to people, a little bit more connected to themselves, and and kind of feel a little more constructive. Use
Mm.
a lot of even the parts of themselves, and this is part of, that I resonate with a lot, even the parts of themselves that maybe they were once ashamed about or they tried to crowd out, to see them as powerful and constructive. And that, hey, maybe there's a part of myself that I always didn't think I should identify with, but maybe actually can help me in some way, and I could use
Mm.
it for good. And so I think she had a really great way of conceptualizing the human psyche that allowed a lot of room for growth. So
Yeah, I've never heard of this distinction between this idea of the human psyche in terms of breadth versus depth. I like it's like a Cartesian plane of personality or something. It's Could you speak to it a bit more? Like what you know
Well,
I suppose breath. You said cultural. Yeah.
I think it's interesting, right? When there's always sort of these metaphors that go along with
Mm,
how we conceptualize ourselves, and there were metaphors that were popular in the 1800s, and there's metaphors today. A
mm,
lot of people like to think of the brain as a computer. Uh,
yeah.
but in the olden days, from more Freudian times, there was this kind of topographical model of the mind where the unconscious was submerged, and there were a lot of uh, defenses that were meant to try to, protect us from things that were upsetting or overwhelming. And so there was, people use the idea of like repression. Oh, I'm going to repress the unconscious, sort of represses the things that are unacceptable to us, parts of ourselves. And so there became this kind of vertical, they call it a horizontal split between the conscious mind
Mm,
and the unconscious mind. And so the idea of depth was predicated on this sort of archaeological dig metaphor, that you were going to go deep
mm, mm,
into your unconscious and understand the things that were deep down in there, and you were going to like hang out with Freud
yeah.
and figure that out. And I think that, while I think that's a valuable kind of conceptualization, there's also the conceptualization that you almost think of yourself a little bit more in terms of what we would call a vertical split, where that there's different parts,
Mm,
almost like you could imagine like a ranch style house where there's a lot of different
yeah.
rooms
Yeah.
of and different pieces of yourself that are yet to be explored. Now, what am I like in this context, and what am I like with that person, and
Mm,
so and what are the things that, the parts of me that are maybe underappreciated. So in
mm,
terms of like broadening your relationship with yourself, I think it's just a different metaphor for,
mm.
how one can
I'm
get in
I'm
touch with.
fascinated by the popularity of these different metaphors. So you said that now that it's very in vogue to think of the brain as a computer. Are there any other trends that you see, or any psychological theories that you just are very prevalent or hot at the moment, perhaps among clinicians or patients as well, that they bring to you?
I mean, these days, it's funny. You asked earlier about pop, psychology
Mm,
books, and obviously like Malcolm Gladwell comes to mind. His books, were particularly popular. But I think these days a lot of people like podcasts, and so they're
mm,
interested in people who have these podcasts like the one we're on right now, but that there are, people who gain fame through talking about that stuff on social media and other ways. And so it's interesting how particular terms make their way into the cultural zeitgeist in some
mm,
way. So you start, and I feel like when I was growing up, it was a little slower. You'd hear something, and then it might take 6 months or a year to enter into everybody's kind of collective consciousness. But now you hear a term, and then within a couple days, everybody's using it. Like
mm,
somebody, for example, used the term "ick," and everyone in the group was like, yes,
yeah,
my client said the word "ick," and I heard it the other
yeah,
day, and what does that mean to get the "ick"? And so, or terms like, setting boundaries has become such a
yeah,
huge idea that's now
mm,
proliferated throughout the culture. So I am always fascinated, maybe like you, in how these things kind of catch on. Like even the term the
mm,
other day, people pleaser. Now, I've
yeah,
heard that now hundreds of times in the last few months, where I don't think I heard it once in the
mm,
first 20 years that I was doing this. So it is sort of fascinating where these come from. Um, and then I think as long as we take the time to sit with it and understand what it means to each person who's using it, then I think we can get somewhere.
yeah. The idea of speed. The last person I spoke to on here was a marketing guy, and he's retired now, and we spoke a long time about how he just feels like everything is just ramped up, so everything is so fast. And you said we have to sit with these things, and the idea of slowing down. I you know I don't know. I think I don't think people have long, especially one-on-one conversations with people that often. As a therapist, you're way out on the end of the distribution in terms of
For sure.
how many that, yeah. Uh, hmm.
For sure. No, and people actually do tell me sometimes that this may be one of the only times they would sit down uninterrupted for, a certain period of time, close to an hour, and
Mm,
have these kinds of talks. I mean, it's,
mm,
the more and more people interact via text or, whatever, platform they're on, a lot of times it gets sort of interrupted and things become a little
mm,
bit disjointed, or things get misunderstood or misread or misinterpreted. And I think that having in the time and the almost the kind of the emotional bandwidth to be able to sit with someone in a conversation, it's such a kind of an exciting muscle to strengthen, to
Are
really
there
to
any ways that you can strengthen the muscle without doing the thing? As in, do you find what are there other practices that help you um, have flex that muscle outside of these one-on-one conversations? I mean, reading comes to mind, but are there any you know specific practices that you have?
good question. I think I am someone who has a constant inner struggle with keeping up with meditation. So I think that that's there are times where I'm better at it than others, or more
Mm,
engaged with the practice than others. I've always been fascinated by meditation, specifically the idea of really getting in touch with the parts of your mind that run wild, and whether or not you can bring it
mm,
back over and over. And that, I feel like
mm,
that sort of strengthens particular parts of your mind, the ability to sort of let it go wherever it wants, and then see if you can harness it in some way,
mm,
and to strengthen attention and concentration. uh, so and I think teaching has helped me immensely in
mm,
terms of executive functioning, being able to memorize the content of a course, and teach
mm.
it, or have to engage with people on a variety of different topics and areas of discussion has helped. So,
Yeah, yeah. Teaching and meditation. Dan Harris, have you heard 10% Happier? He speaks specifically about that return to what you were to, whether it's the mantra or just a breathing pattern. He compares it to a bicep curl. It's like that act, that cognitive act of coming back. That's
mm-hmm.
what's flexing the executive control muscle. Um,
That's right. And there have been
are
people out
there?
there who've
Hmm,
tried to, argue for meditation being helpful for ADHD.
sure.
So,
What ADHD is such a what are your thoughts on ADHD?
oh
Do you
wow.
treat it a lot? Do you encounter patients a lot? It's
Yes,
yeah. So
yes.
I'm you know tangent peripherally familiar with it. I know that what's fascinated me is that the rates of ADHD diagnoses have, I don't know the exact numbers, but I think they've like quadrupled in the last 15, 20 years or something.
Mm-hmm.
And the theory is, as far as I understand it, is that the um, neurological prevalence in the population hasn't or shouldn't have increased in that amount of time, but that people are now showing behavioral symptoms due to external factors at a higher and higher rate. Does that sound right?
I think that you're definitely onto something there. I mean, it is, any kind of scientific inquiry has to be curious about an immense uh, increase in the percentage of anything over a short
Mm,
period of time, right? You think about, well, why would something like attention deficit hyperactivity disorder increase that much, right? From maybe 2% of the population to, multiple times that. And it's probably, the answer is probably multiply determined. There's probably answers that people are getting better at recognizing it. People are certainly much more attentive to it in kids. When I was growing up, a close friend of mine certainly meets the criteria for this. They would not have been diagnosed. Nobody was looking for it. It wasn't something that was in. I'm not even sure that a pediatrician would have been interested in that. So I think part of it is that we're getting better at recognizing the signs and symptoms. But I think the other tricky thing about attention is that attention is such an interesting and kind of executive functioning concept that overlaps with so many other kinds of presentations. So if you think about it, people who are depressed, they have trouble paying attention, understandably. People who are anxious, anyone who's ever been anxious, can you really pay attention to something when you're really anxious? It's pretty hard, right? Yeah. And people who are habitually anxious about a lot of things that present itself. So, you talk about, people who suffer from trauma have a tremendous difficulty with psychic organization and trying to pay attention to certain things. They've struggled. So with all that. So I think, one of the tricky parts about ADHD is that there's such an overlap with all these other
be able to separate areas. It from other.
It's not a person is not a textbook. So in a textbook, it's easy. Like, okay, so they got these criteria and we're going to figure out who's in and who's out. But that's not humanity. And so I'm always interested when I'm working with somebody who either has been diagnosed with ADHD or it feels that they have it in some way or has been medicated for it. What does it mean to them? What is their relationship with their own mind? How does it affect their daily life? And in what ways are some of their attentional capacities constructive? I mean, there are all sorts of studies that show that people with, what we call like ADHD kind of a brain, that their mind works more creatively and flies in different directions than other people's minds. So how is that, going to help them? I think there was, maybe speaking out of turn here, but I think there was a famous political strategist who was talking about how, somebody said, well, hey, maybe you should try some ADHD meds. You seem like you're on this kind of ADHD spectrum. And then after trying it, he said, I lost a piece of how I love how my mind works. This is me. I go in 1,000 directions. So trying to understand each person's relationship with their mind, I think, is and their attentional capacities and what it does and does not allow them to do, I think, is part of the battle. So it's easy to sort of say, like, all right, you got ADHD. Here are these 6 things you should do. But I think we should be a little more flexible in our understanding of it.
What are some big misconceptions that people have about what it's like to be a clinical psychologist?
Oh, wow. I don't know. I think so much of it has changed in recent years, right? I think that it used to be this mysterious land that no one had ever encountered before. And that's probably why Carl Rogers, Albert Ellis, and Fritz Perls in the 1960s televised. They televised a session with Gloria, who was a real patient, who they tried to say, like, hey, this is what therapy really looks like, to demystify it. I think these days, there's so many therapists on social media, and TikTok and Instagram and all this stuff. I think people have a lot of ideas, and think about television shows too, both television shows like what was the one where there was an actor and he had all these, it's going to escape me. In Treatment was interesting to look at, relationship that one has with a client, and then there's things like couples therapy that's on TV, and there's tons of shows that kind of show certain versions of what therapy might look like. But I don't know. I guess maybe that people think that it's, I don't know, rigid or not fun, and I would try
Mm,
to challenge that. I
mm.
think you can be creative and yourself and create all sorts of meaningful connections with people, and to be kind of lucky enough to be let inside people's worlds.
Yeah, I think of humor as the sign of mastery. I like a lot. So if you're, it sounds, if you're able to bring humor to a session, I'm sure it's good.
I I think I
Um,
use humor a lot, so maybe even
yeah,
defensively sometimes.
yeah, yeah. I'm thinking back to the comment on other strategies that help inform your practice. You said teaching. You said meditation. On the flip side of that, I'm wondering, there's a push now to do so many things to improve your health. Like, and this speaks to, you said, oh, the therapists on TikTok and therapists on this. And so in some ways the information is out there. We know what to do. You know to eat well and get sunlight and stay hydrated and talk about your feelings. And what do you think of this uh, other end of the spectrum where you over optimize and that can be stressful, you know of course, like balance in all things, but how do we get there?
Hmm.
Because especially with social media, it's easy to compare yourself to other people who seem to be optimizing better than you. And I'm curious as a psychologist how you think about that.
It's like that old Seinfeld episode where the guy's screaming, "Serenity now!" Just such a
Yeah,
funny
that's right.
oxymoron.
Yeah.
Um, screaming for any. I mean, anything can be compulsive. I mean, that's one of the sort
Mm,
of hallmarks of psychoanalytic values, that anything can
mm,
become sort of, neurosis is compulsive. It's when we sort of lose a particular volition or choice or in ourselves, and we move towards kind of a defensive compensation for something, where we're kind of reacting and we're avoiding, or we're kind of doing something without even thinking. We're compelled to do it. That's the word compulsive is, right? And so I think that even health, if can become something where it can take over in a way that obviously might become unhealthy at some point. I mean, self-regulation
mm,
is the name of the game for so much of us, right?
mm,
How do we self-regulate? How do we emotionally regulate? How do we balance our lives? There's so much stuff out there that's pulling us in so many different directions. So, and I think one of those directions probably could be to overthink about health, where you don't allow yourself to
mm,
have a break, right? It's no, you don't allow yourself some moderation. Like some people, it speaks to sometimes how punitive people are with themselves. And as you mentioned,
mm,
social media, we're always in a constant social comparison with not only what people are, but what they're posting of themselves. This kind of idealized, like this idealized version of themselves. And of course, you're always going to come up short with the idealized version of somebody else. And so,
yeah.
I think rather than focusing on all those other people, to try to strengthen the understanding of what it is that, it means to be kind of in your skin, and try to understand, like,
Mm,
why am I, you know, competing so hard? Or why is this so important to me? Not to say that it shouldn't be, but to be kind of interested in that relationship with yourself is, I think it's really important. So and so it doesn't mean that you can't have a tremendous focus on one thing or another. It's nothing wrong with that, but to try to understand, like, well, why am I doing this so much?
mm.
So then it gives you at least the
in
choice to
in the day
regulate.
to Yeah, yeah. I'm curious, in the day-to-day trenches of being a psychologist, what's the hardest thing? Is it, yeah, you know?
The hardest thing. It's a great question. And it's something I don't know. What's the hardest thing? I mean, there's so many things that are challenging, but I sort of
Mm,
look at those things as something that I like challenges. I want to be a little bit uncomfortable sometimes with something. I want to, an uncomfortable silence, or I want kind of to make room for things that are a little bit new and surprising. So, but I don't know. I guess sitting with all of the powerful feelings, maybe. I think that can sometimes
mm,
be challenging. You know, um,
mm,
that sometimes that you feel for people who are really, you know, really going through it, and so and you wanna, that's why you sign up to do this, right? But then
mm,
holding on to those feelings and seeing like, wow, this is really something that's powerful and important. I think that's sometimes can stay with you, but I don't know. I don't think that's a bad thing. I think that's part of being someone who's human, to take on those emotions. Um, and that's why, and I can't believe it took me this long to say this. That's why every therapist needs to be in their own therapy, so they have a place to
mm,
discuss and process and understand and have really good collaborative kind of understanding of what it all means to do this. I think, and to be, and I think the other part of it is to be on the other side of the room, right? What is, you have to have an
mm,
appreciation for the courage it takes to open up in sessions, right? To
mm,
open up in a therapy, to trust someone with something that's really vulnerable, that you won't understand until you're a patient yourself. And
mm,
so whatever the challenges may be, or whatever feels tough in the moment, whether it's a strong emotion or something feels overwhelming, you have these places where you can talk about things. I get together with colleagues on a regular basis to talk about not really specific cases, but things that come up. Hearing
mm,
about particular things that people struggle with that are unimaginably traumatic and sad, and you need other people to have those kinds of conversations with. So I don't know. I
mm.
don't know if I didn't answer the question, like what's the hardest part, but just maybe it's okay. So maybe it's kind of um, the challenge is to connect with enough people who are interested in this work so that you don't feel isolated. Because I definitely remember there
Mm,
were people who I knew when I was first starting out in this field, who would sit and see 40 or 50 people a week, and they would just sit there kind of with each of them, but they weren't interacting with colleagues. They weren't sort of
mm,
having this kind of, so in some ways it was, they had these incredible relationships with patients, but they felt kind of isolated. So I think I've always trying to strive to, and I think that's why I teach and I do all these other things, so I can kind of stay connected to a variety of different people and different parts of myself.
yeah, that answer is surprising. I guess I assumed that it would be something client facing. I mean, you spoke to sort of empathizing with, um, the darkness and staring into that and not, and what it feels like to have it then stare back into you, but the just kind of logistical problem of interacting with other people who do what you do, both for, it sounds like, perspective and for camaraderie. It's an interesting, that's an interesting point.
Yeah.
I'm so curious about the, you know, therapist getting therapized situation. I call to mind like it's a spy v spy, and you hear that doctors make the worst patients. You hear like medical doctors often are the worst about going to get themselves checked out. because they're so close to the material in some way. I mean, it's I think legally as a therapist, is it legally you have to be in therapy, or is it
No,
like a best practice
no,
situation? No.
it's not illegal. I think it's
Uh huh.
strongly encouraged, especially
Mm.
when you're in graduate school. I think it was very strongly encouraged because look, everybody is going to touch your life in some way, and so it's going to bring up stuff in you. I mean, the way I
Mm.
work, you're having to understand how this person, not only when you're working with somebody, not only how they are, but how is it activating particular parts of you? Well, what is it making you feel? How are you using yourself a little bit as a barometer for what's going on? And it's going to tap into your own inner conflicts, your own issues. And so if you don't have a place to work those out, I was sort of going to give that answer, like what's the toughest part is to try to, work with the parts of yourself that come alive or have particular, it's particular meanings that strike you in a particular way. So I mean, it's interesting. I really feel like, whatever a patient brings into the session, I I feel privileged to sit with, and I feel like
Mm.
connecting with them on that is that's what I love to do. But then yes, it's going to have some sort of particularly individual, like idiosyncratic effect on each therapist who is
Mm.
out there. Right? Somebody might find it challenging to sit with one kind of patient because it makes them think about a loss that they had, or makes them think about a particular anxiety that they've had. So that's right. That's where the work needs to be done. Right, where you have these kinds of you know personal feelings that come up, and you need your own treatment to help understand that in yourself.
Mm.
There was a famous psychologist, Sheldon Bach, who talked about how every therapist has their own sort of narcissistic equilibrium. You've put narcissism not as a pathological thing necessarily, but just on a continuum, like a spectrum. And
Mm.
so we all have different parts of ourselves that are hit in certain ways. If a patient leaves treatment, or a patient, says this or that, or you feel helpful one day, or you feel lost one day, or you feel stuck. And so, negotiating those parts of yourself that are, as a human being, is essential. And so when you're in therapy, you can understand, oh, that's why I was feeling that. That's what that meant to me. Okay. Right. And if you don't have that insight within yourself and that experience of what it's like to be a patient, I think that you're probably missing some important piece of the work.
If I'm curious, if you wouldn't mind putting on the professor hat for a sec, I'm curious about,
Okay.
it's sort of a developmental question, on as to the field of psychology as a whole. I read recently this idea that talk therapy kind of came out of the confessional, the religious confessional. Is
Yeah.
that something that you buy? Is it?
Talk therapy. I mean, I think, Freud probably invented talk therapy after he found that hypnosis wasn't doing the trick for him, that he was more interested in what people were saying than what he was saying to them. I think that, people have always had parts of themselves that they wanted to let out, and parts of themselves they wanted to connect with other people on, around, and hear, to be feel recognized and heard, and to have a part of their own experience reflected back to them. So I think that that's probably very much in the confessional way, but I think probably from the in every culture since the beginning of time, there have been people there to listen and help people to talk about parts of themselves. I think it's probably something that it was existing in various forms long before this current iteration.
you practice in New York City. I'm curious, are you still confronted um, with the stigma around uh, psychology, psychotherapy? Um, have you felt it abate at all in the 20 years that you've been in the field?
It's a good question. I think it really it's so individual, right? It's
Mm.
hard to talk about it nomothetically, like an aggregate.
Mm.
I think that on in certain
That's what I've been trying to
pockets,
do for the last hour and a half.
I in certain pockets, I think that mental health still needs to be talked about, and
Mm.
made people need to be made aware of it, because I think that there are plenty of people out there who associate therapy with feeling weak, or feeling like there's something wrong with you, or feeling like, oh man, there's something shameful about it. And it's not. I mean, the variety of people that come into therapy, that, I see people from, all backgrounds, all experiences, all types of identities. And so I, it's for everyone. It really is. And you don't have to have, meet those specific criteria for a diagnosis in order to talk about what's on your mind, and what's bothering you. And so I think there's still a stigma out there in particular areas. And then the pendulum swings way over in the other direction, where therapy is now, for certain people, a household kind of thing that everybody knows
Mm.
about, and people watch their favorite TikTok therapist every day, or they wear a shirt that says "I love my therapist," and they're walking around Brooklyn. So I mean, I
Yeah.
think that's great. So, but I think that, it depends, is I guess the best answer to that. So there's still some work to do. Mental health parity, I think, in legally has only been a thing for 20 years or so. I think we got a
I'm sorry,
long.
mental health parity?
Yeah, there was the Mental Health Parity Act that was about 20 something years ago, which tried to, uh, equalize the way that, mental health coverage, right? Mental health services were
Mm.
covered by insurance companies the same way that
Mm.
physical health would be. It elevated mental health to be taken as seriously as it should be, rather than say like, all right, okay, well, you got to pay out of pocket, and if you don't have enough money, then you don't have you shouldn't have access to mental health services, which is ridiculous. Everybody should be able to have access to mental health services. So I think that went, but it went a long way to have a lot of these particular therapies be reimbursed and covered by insurance. So that's fairly new. It, really
Mm.
didn't happen 50 years ago. Uh, so I think that that's so there's some progress there, but I think that, yeah, I would like to see insurance companies and various other places cover more services and at better rates.
I was about to say, I don't know how effective that bill was. Yeah.
Well, it went from zero, right, to something.
Mm. Right.
So,
Right.
and now every single, most, I would say, insurance companies have a behavioral health part. So, which wasn't the case. Like, that's what they call it, behavioral health. So, but, so I think that so I don't know. I think the stigma has reduced, but it could still use some more reduction. And I think that, part of the nice thing is that a lot of people are really becoming more psychoeducated out there. Occasionally given
Yeah.
some ideas that might not be so accurate, but mostly it's good.
Are there, apart from the obvious, ones of, I don't know, you hear social media, are there any things that worry you from a clinician's perspective about the general, mental health of
Hmm.
your patients?
It's hard to talk about that, particular people. But I think in general, yes, I do worry, and this will make me sound like I'm 1,000 years old, but I do worry that the more and more human connection goes online, that something will be lost. The more people spend watching screens, the more parents spend watching screens or putting their babies in front of screens and not connecting to each other in real time, in real life. I do think that, I mean, even the studies that have come out since the pandemic, that eye contact isn't as strong, or that people's are not able to label and reflect on their emotions in the same way. There's certainly studies that have been warning us about that. So I think that you mentioned social media and the internet. I think that the more virtual our world becomes, and again, I guess this makes me sound old-fashioned, but I do worry that something will be lost in the emotional connection between people.
Yeah, just hyper digitalization writ large.
Yeah, it's so that's.
Well, my fantasy for this
important.
podcast is that eventually I'll be talking to people in real life instead of getting them to. So and then, well, yeah.
No, the parallel process here is not escaped me. So
Yeah.
yeah.
Oh man. Well, we're over an hour. I don't, I think this is the time where you say that our time is up. But
right, you know what the music means.
Thank you. Yeah, that's right.
It used to be.
Thank you so much for taking the time. I really appreciate it.
Thank you.
Yeah.
I really enjoyed our conversation. Hopefully,
yeah, this was fun.
I didn't say anything, too out there, but hopefully everybody can, get a sense of some of the work that people in my field like to do. So
yeah.
Thanks
I really
so much.
Appreciate it. Next time we'll do it in person.
Sounds good. You bet.
Sounds
Right.
good.
Take care.
Have a good one, man. Thank you.
You too.